As plastic surgeons, we often add sodium bicarbonate to our local anesthetics while giving blocks while performing procedures under local anesthesia. So why is it that sodium bicarbonate is added to local anesthetist? There are a couple of reasons. Firstly, there is less pain. Local anesthetics are often acidic to improve their shelf life, but this acidity leads to burning sensation when injected. Now, when we add sodium bicarbonate, it is an alkaline substance and it neutralizes the acidity of the local anesthesia, making the injection less painful for the patient. Then secondly, there is faster onset of action. Now, local anesthetists need to penetrate the nerve cell membranes to exert their effect, and they are typically in their non-ionized form. By increasing the pH with the use of sodium bicarbonate, more anesthetist is converted into its non-ionized form, and therefore the onset and effect of action is faster. Thirdly, there is enhanced efficacy. Now, especially in those areas where there is slight amount of infection or inflammation, local anesthesia doesn't tend to work well. We all know that. The tissue pH is often lower, it is more acidic, and therefore the effectiveness of local anesthesia is reduced. So if we alkalinize our local anesthetic with sodium bicarbonate, the effectiveness in the acidic environment is also improved, thereby there is better pain control. And one of the other reasons which is postulated is that it also helps in enhancing the spread by reducing the precipitation of the anesthetic at the injection site. So when sodium bicarbonate is added, it improves the distribution of the anesthetic across the nerve tissues and helps in a more effective block. Now, how much do we add? We typically add around 1 ml of 8%, 8.4% sodium bicarbonate to 10 ml of local anesthetic. Although this is a rough estimate, the exact amount can vary depending upon the specific clinical situation. However, it should also be noted when we are adding sodium bicarbonate to certain anesthetics like bupivacaine, excessive alkalinization can also cause precipitation of that particular drug and make it useless or less effective. So all these things need to be taken under consideration while using sodium bicarbonate.